there's something in your eye? Like, you don't wear contacts?
I don't wear contacts. I don't know. No, he referred me up here. You know, I went up there with some eye problems. My eyes had been hurting really bad. And...
referred here for an eye infection?
No, I went over there for him, you know, having some eye problems, and he sent me over here, and he was telling me about the implant in my eye, and I'm like, there should be nothing in there whatsoever. And he was like, he was urging me to come up here to see y'all. So here I sit, and
okay, but your story is just kind of...
it was crazy.
Kind of strange.
It was strange. I was like, what in the world is going on? Like, this isn't supposed to happen to me. I'm a normal person. I've got 4 kids I raise every day, all day, you know?
Yeah.
So I sure as heck don't need...
I'm not sure what, you know, we have the emergency room physicians here that might refer you to, like, an ear, nose, and throat eye type specialist person.
I mean, do you not see anything in there?
I personally, I can't. I mean, I see like a little bit like to the left, but
yeah, you can see the edge of it, but it's actually covering my whole pupil.
But it doesn't like look like there's like a film. Like, I'm not an expert at this, so I'm gonna let them decide.
Yeah, okay. Is somebody else gonna look at it?
Yeah.
Okay, definitely let the doctors look at it at least, because you know he sent me away and we were talking about it. He just seemed like, I don't know, it seemed like it scared him a little bit. And I'm not gonna. It scared him. I could tell.
Yeah.
When he looked in my eyes and looked at me when we were talking, he was scared.
Who did you see?
And I've been scared for the past 5 years. Like, it's been crazy.
Who did you see in Brevard?
It was Dr. Hooley, I believe.
Hooley?
Yeah.
H-U-L-E-Y?
H-O-O-L-I-E.
H-O-L-I-E?
Yeah, he gave me prescription for eye drops.
Okay. So I'm just going to finish some of your medical history. Are you taking any prescription medications at all?
No.
No? Okay.
And, like, I didn't sign up for anything, any surgery.
Okay.
It didn't, it's not supposed to be there. I've talked to the news, or tried to talk to the news and the sheriff. So I've been talking to everybody. So everybody's, you know, urged me to come up here to see you guys first. So I'm trying to just go by the steps and see what I need to do to get this out of my head, out of my eye.
Any medical history? Pertinent medical history?
No.
Do you smoke or drink at all?
No. I smoke cigarettes.
Okay. Pack a day?
Yeah, about a pack a day.
Any drug use over the past year?
No. I'm on prescription Subutex.
Okay.
So I got the past drug test and all that stuff.
Okay, so you are taking Subutex prescription? Is that the only thing?
That's it.
How old's your little girl?
She is 10 months. She'll be 1 soon. She's getting up there. And then I've got another little girl who's 2. I've got a 4-year-old boy, and I've got a 7-year-old boy.
Are you taking, is it 4 milligrams?
It's
the stuff under your tongue?
Yeah, yes, 8 milligram tablets.
Okay.
3 times a day.
She's cute.
Thank you.
Okay.
So yeah, I'm trying to get this figured out for these kids. I got to get everything straightened out. My head fixed.
So these are just screening questions. Suicidal thoughts at all?
No.
Harming anyone else?
No.
Okay. Do you feel safe where you live in your environment?
Sort of. Not really, no.
It's
got something to do with the eyes, yeah. It's got a lot to do with these eyes. Me finding this out has made me a little bit paranoid about, you know, how somebody could have done this to me without my knowledge.
When's the last time you had tetanus shot? More than 5 years or less than 5 years?
I'd say less than 5 years.
Pneumonia vaccine ever? Flu shot last year?
No.
Okay. All vaccines up to date as far as you know?
Yes.
You been out of the country in the past month?
Nope.
Okay. This is Susanna, nurse practitioner. She will be assessing you over, okay?
Okay.
All right.
Hey, thank you.
Tell me what's going on.
Okay. I was having some problems with my right eye.
What kind of problems?
Day before yesterday, pain and inflammation. Turns out I have an infection in there. I went to the Looking Glass Eye Center in Brevard, and we were sitting there talking. He had looked at my eyes, and he had told me I had an implant in my eye. He said the implant, it's nothing to do with the implant. It's causing the infection. So it took me back for a second. I said I shouldn't have an implant in my eye at all. There should be nothing in there. He referred me to come see you. He said there's an implant in there, and he said he got really scared, like when I told him I didn't know anything about it. And he said you need to go see them. He can't remove it. I was like, what? Can you remove it for me or something? And he said he couldn't. So I'm just trying to figure out what's in my eye, what's going on. Okay. I went home and looked, and I could see what it is in there. I could see it, but I'm not a professional. I don't know nothing about it.
Any itching?
Yeah, it's burning right now. The right eye's burning.
Any drainage from it?
A little bit. I would wake up in the morning and you know how your eyes can be sealed
crusted?
shut?
Okay.
Yeah, my eyes been sealed shut a little bit.
Did they put you on any drops?
He did prescribe me some drops.
Do you remember what they were?
I don't. I had it in my wallet and I meant to bring it just so I could remember the
Have you
doctor's
started
name.
it yet,
I hadn't
or-
started the drops. I need to
Okay.
go up there and do it. This was the day before yesterday. You know, I wanted to come up here yesterday, but I was so excited. I didn't want to come up here and look too eager, and you know, I just wanted to calm down and think the situation through.
Okay.